Hey everybody, I'm Joy Purdy, host of Discover the Joy, the Purdy podcast. As we continue recognizing Hispanic Heritage Month, meet the Padrons. They are a husband and wife dentistry duo. They have a really interesting story about how they came from Venezuela, met here in the United States, fell in love, and bought this dentistry together here in Clay County, Florida. Be sure to subscribe on YouTube, follow me on Apple Podcasts and Spotify. And be sure to watch the last couple of minutes of this episode because what's even cooler about their story, the Padrons really want to give back to the community. So we got to be there when the Padrons surprised someone, gave them a gift of a brand new smile. Thanks for joining me for another episode of Discover the Joy, the Purdy podcast. I have with me Adriana and Fernando Padron, and their joy is dentistry, and not just dentistry, they are specialists. I can't wait for you to hear just how involved they are, their backstory. It is really, really interesting. First of all, I said you're dentists, but you're more than that. What are you? It's hard for me to say the word.
Prosthodontist.
Prosthodontist?
Yes. Adriana, I'll let you start.
What is that?
So basically, we go for general dentistry, and then once we get into the specialty, we learn to reconstruct patients' mouths. Like, let's say if you have a lot of teeth that are missing, we place implants. We do cosmetic dentistry. Patients that general dentists are not able to take care of because it's a complex situation, dentures, partials, you name it, we do it. So it's reconstructors pretty much.
And I hear the word prosthetic in that word, so you do prosthetics.
Come from there. It's like complex treatments. It is a little bit of we are trained how to treatment plan and how to foresee future problems. So we take cases that are fairly complex where patients, they don't have any teeth, they lost height of the face, and then you need to start from scratch. Where do we start? How do we take them back to the right height of the face, speech, and everything? So it's pretty much, we are a super general dentist, I guess, call it that way.
It sounds like a lot of patience because this sounds like a process that takes months. Is it a lot of studying? That I think dentist already is like years of study. So what is all involved just to get to this point?
Well, you go through your basic studies to become a dentist, and then there is only five specialties that are approved by the American Dental Association. So prosthodontics is one of them, and then it's a 36-month program that you go through when you have, of course, a lot of theory and practice, and you see tons of patients, so you have requirements that you have to achieve in order for you to graduate, X amount of crowns, X amount of implants, X amount of full mouth reconstruction. So, and then when you're finished your program, you can do an extra year, which is a maxillofacial prosthodontics, which is also very niche. So patients that has like lost an eye or an ear due to cancer or an accident, you subspecialize into that. But first you have to be a prosthodontist. So there's a lot of study, a lot of articles, a lot of literature review. Adriana is actually board certified prosthodontist. She went through the full certification. I'm a board eligible prosthodontist. So yeah, there's a lot of study and hours, and your lab and your school becomes your house. You spend 12 hours a day, 10 to 12 hours a day, easy.
So what's the difference between what you do? What is the difference? Because you were just mentioning how she is a different certification.
No, it's the same thing. Like Adriana went through the full process of board certified. So it's depending on the programs. There's some residencies that are more, they train you to become a board certified because you have to document the cases and you have to go through all that, which in my program was more towards, I would say, clinical, more private practice. So we didn't spend too much time in documenting cases rather than doing a bunch of crowns and implants and stuff. It was more on the practical side, and I would practice more. But Adriana had that board certified. It's like when you go to a plastic surgeon, right? Oh, plastic surgeon is a board certified plastic surgeon.
So it's a test or an exam.
You know, she has an extra, the highest level of certification in prosthetics. She has it.
Gotcha. So which is kind of what's so unique about your business here. You do the regular, I want to come in for my 6-month cleaning, I can come here and get that done, but you can also totally reconstruct here. So tell me how this came about, because you have got a cool story here about how you started this business.
So we have the amazing Dr. Boytet. He was in the dental field for 40 plus years. He built this place and it was already established for 20 plus years. And he was an amazing dentist. He's retired now. And he wanted to leave his legacy to someone that will take care of his patients and his team and what he built with his own hands. So we happened to meet him and he said, you guys are the ones. And so he was very, very proactive in the community and the dental field. He was part of an amazing group of implantologists or specialists that are related to the implant field. He can reconstruct implants as well. And so when we met, it felt like this was our place because we have the room to grow as professionals, but he had built a beautiful community and foundations for us to take the baton and continue working with.
So this was so interesting, Fernando. You actually only worked for him for like 3 months.
That is correct. That is correct. We worked, and I guess it's like love at first sight, would you call it that way? He had, because it's such a great place, the team is great, patients, the community. He did, everything he built throughout the years. Obviously, you have a private equity trying to acquire businesses nowadays, and business in dentistry is changing. It's going through a lot of changes when it comes to that in acquisition, how they take over multiple practices and the business model. That he could have sold to any of those, but he cared about what he built throughout the years, and I guess we were the right people that it's been looking for. And to the point he's still our patients. He comes here, his family will still text each other and see each other. He sometimes drive by and drop some pizza. I guess we were the right fit,
Yes.
And it was not about the money, because he got a higher valuation. He could have sold for those, private equity. It was just about the right fit for them, right people to take over them.
Well, it says a lot about the two of you if he literally did not know you for that long and said, you are the ones I want to take over this practice. That's huge. That's a big deal. Now I hear accents.
Yes.
You gotta tell. I do. Where are you originally from? And it's interesting, you're from the same country-ish, but you didn't know each other.
We're basically a fruit salad. That's the best way to put it. So yes.
We are from Venezuela, okay, but we met in the United States. We met in Florida, at Nova, where we did our studies. I'm from Caracas, the capital, and Adriana is from a small town.
Yeah, from different places.
Yeah, different
places. Because I lived everywhere, but
we met here,
yes.
Surprisingly, and it's crazy because when the first time we met, because we're in the same country, people like, hey, I have a friend who's from Venezuela, I want to introduce you. So she was a friend of ours that it's in common, wanted to introduce Adriana to a friend of mine so they could date, but Adriana met me, and of course she fell in love with me.
Of course.
And that's it, the rest is history.
So this is very interesting, the way you have handled, because both of you, these are high-powered jobs, and you have to dedicate a lot of time to it, but you worked it out so that one focused on the job and then the other got to focus on the job. So tell me how that conversation happened and how it was like supporting each other, because you have an idea of your career and you want to just go, and now you have somebody else who has a career. So tell me about the balance.
So I feel like from the first time we met and we started dating, we always respected each other, and I feel like that's the key of this relationship, because we went through the same training, same specialty, same background, And we were very clear of what we wanted and how we were going to handle. Even before we got married, we were like, okay, what's going to happen when we have kids? I want to be a professional, yeah, but I want to be a mom. And that's why I picked this profession. And he's like, our priorities are family. So whatever you think it's going to be what works for us, that's what we'll make happen. And even being him a resident and me being in the process of getting the license here in the States, we kind of like felt like we could work together. So you either make it or break it, and in this case we made it, and we would respect each other professionally tremendously. He's more surgically driven, big cases driven. I'm more like the boutique dentistry and the delicate, like small cases that I spend like at that time. And like we complement each other in that way. So, and even when we don't agree, we're like, okay, yes, I mean, I guess we're right, or you're right, or, and now that we have a family, we got into a point that we're like, okay, how are we going to handle this? And we were agreeing both in the same thing. So I guess it worked, and it shows in the office how the energy flows, how things are here, that, you know, it's comfortable. It feels like, again, organic.
Feels good. I think we made a great team in that regard. You know, like it was something that we talk, and we didn't have to like fight a lot over like, oh, well, I'm gonna have to work, and then you're gonna have to stay home with the kids. You know, it was just like a natural transition, and that's how it's been since, you know, we met. You know, we've always been a great team, and I think that kind of reflects in our culture here at the office as well. That, you know, we're following what Dr. Boite built, and now we're making it ours and better, and we keep helping the community, and with that sense of family and good values.
Yeah, because it's not easy to work together and live together and work together and live together. But I do feel that when I talk to you, and I've been in this office several times just observing and watching you talk with other people. So, you know, I feel that. And right now you are focusing on the kids, and your kids are how old, boy and a girl?
We have 1 and 1. Amelia just turned 6 and Daniel is 3. So
you've got your hands full.
Yeah, but I'm here too. So we made that work. So in a way that when they're at school, I'm taking care of some of the things at the office while he's working full time.
Yes.
So I feel like the point here is like we bring each other up and we complement each other in every step of the way versus like bringing you down and bringing the negative. So I feel like that's probably our plus here as a couple.
Well, tell me a little bit about, but before you got to this point, you know, you both had to study, you both had to put in but you split that up and you allowed one to focus and then the other. So tell me how that worked. Who went first?
Well, I went first, you know, and then Adriana got accepted into a different dental school while I was studying. And
you were studying here in Florida.
I was studying in Florida, and then Adriana was teaching at school, but then she got accepted into
the University of Florida.
The University of Florida, and I was in Fort Lauderdale. She was in Gainesville. So yes, while I studied for a little bit, she was working, and then she got accepted, and then he said, well, what are we gonna do? We're you know, we need to be together. So she transferred from Gainesville to Nova, and that's how we continue.
So now both of you are in Fort Lauderdale.
Yes. And then when I graduated from my residency, Adriana started studying again for her, because she was doing pre-doc and I was doing my residency in pros. So I graduated so I could start working. And then she said, hey, I want to be a prosthodontist too. I said, okay, well now it's keep studying and I will be working. And that's how we dated for like 3 years. And it was great. You know, I worked, you know, she was a great support as well, because, you know.
This was in Chicago.
I know, you ended up being accepted in Chicago.
We had never seen snow at that time, and we had the polar vortex that year.
2013 was the worst winter they had in Illinois for 50 years.
Yeah, so.
And that's, I've never seen snow. And then we landed in Chicago, and it was like the worst winter we've ever seen, and they're seeing, and Austin said, well, this is what we experienced the first time. I mean, it's not gonna get any worse than that. So, you know.
How was that winter for you?
I loved it.
Yeah, we loved it.
The snow, I remember like the first snow, I told my program director, Dr. K, I've never seen snow, so I'm sorry, I cancel patients and I'm gonna go to Starbucks and have a cup of coffee. And I did that. And he's like, just go. And I sat there for like an hour and I called everyone on FaceTime saying, oh my God, I'm seeing snow and the snowflakes. And it was beautiful.
Yeah.
So,
It's beautiful.
Yeah, it was a great experience.
So beautiful that after you were done, you left.
After 8 years, it's like the first winter is great, and the second, and the same, but it was great. I mean, the people that we met, the experiences, and everything, I wouldn't have it any other way. It was great. It was great.
And then you came back here because, and I say here, we're in Fleming Island, which is in Clay County, North Florida. So you came back here.
We came to Jacksonville because my in-laws lived in Lake City. Adriana's parents live in Lake City. She has also some extended family that live in Jacksonville and San Marco area. So I said, okay, what's the best place for us to go? Let's go there. We have our kids. They're going to be close to our parents. And that's I started in working in Jacksonville. But then a friend of ours told me, hey, there's a practice probably in Fleming Island. And I said, gosh, that's kind of far. I don't know. And I hesitated to come and meet Dr. Boytet, I swear to God.
It's like a good 30-minute drive from Jacksonville.
We were, yes.
Yes, it was like 35 minutes, yes. And then I said, I don't know if that's too far. I don't know the city enough, so I was like, okay, I'm living here. Extended family is close. My in-laws are here, so I want to stay around. But then I'm going to go. And then I drove here and I remember, wow, this is nice. And then I told Adriana, we need to go and see
He told me, I'm not going to tell you anything. I think this is it. You're making the final call.
Yes.
But I want you to go and check it out.
Yes.
And we'll go from there.
Yes.
So.
And it was good. And that in between, I was working in different offices, like 3 or 4 here and there. But yeah, once I came here, I was like, wow, this is nice. So I'm glad that I came over. Otherwise, no, I would never,
But I love this continuing thread throughout your lives together. It's a give and take. It's a check in with each other. It's a make a decision together. So I'm enjoying hearing about this.
We're firm believers that when it's meant to be for you, it flows.
Absolutely.
It flows.
Absolutely.
And if it's not meant to be for you, God, universe will take it away from your side. And we said, hey, if it's meant to be, it'll happen. And it was a smooth, beautiful transition. So we couldn't be happier.
It didn't feel forced. We were looking for other practices, and I was like, yeah. But when I came here, and I was like, wow, this is nice. I'm not gonna say anything. Please come take a look. She said, okay. And then she really liked it too. So I said, okay, it's fine. If I got your blessings, let's do it.
So now let me ask you about the work. Your first thing that comes to mind, extreme case. What kind of things have you seen that we would just be like, wow, people are dealing with this kind of thing?
Yeah, well, I've seen it all, but I can tell you people not being able to obviously smile or eat properly, and how that, the smiling, how that translates to a person that is not fully complete. Sometimes we take for granted the fact that you can smile, and that how the world perceives you around, and how people are kind of like, like shy, and they look like sad, and it's a different person when they're able to give them back that smile, how they change. More opportunities come to their, the door. They have find jobs, relate better to people, find a partner, eat better. It's so important. So I've seen it that people that it's been mauled by, disease and bad dentistry, that are really affected psychologically. That's the worst part.
And I feel like the fear of the unknown, coming here, and it's like, I don't know how much it's gonna be, I don't know how long it's gonna take, I don't know what they're gonna do to me. So that, and we've had patients that are systemically compromised, meaning that they have diseases that, are challenges for us to do any surgeries, and we work multidisciplinary with either doctors or some other colleagues in the dental work to make it happen. So, that versus certain things here, I would say those are the most challenging things.
Fear of the unknown, like Adriana said, we have patients, and across the board, there's a generation that back in the day, there was no, doctors were, I guess,
No anesthetic.
no anesthetic. You know, I think one of the good things about social media has brought some awareness, and people are able to communicate how they feel better to other people and make awareness of, hey, this person is good or this person is bad. So for us too, it's a check like, hey, you have, I mean, we're nice, but if like 30, 40, 50 years ago, dentists used to be like, oh, it's hurting, I don't care, just hang
Pull
on
it
tight,
out,
I'm gonna be
yeah.
done. So that actually created a lot of trauma for people that we're still seeing, even though after they're 50, 60 years old, I see people that are terrified when they see us coming into the room. We get that a lot. I hate you guys, but not you, I just hate this. So for us also, treating that part like, you know, pat on the
That's a big
shoulder,
challenge,
you're gonna
but
be
in a good way.
fine, you know, that damage, it's a lot, you know, for them. So that's one of the things of the consequences that we've seen a lot, that it's not, you know, easy to deal.
But it also sounds like that's one of the things that you love, is to be able to bring that comfort level down. Tell me about some of what you love most about your jobs.
I love that I actually sometimes I beg patients, just please give me the chance to show you that this is something you can handle. I promise you, I'm going to get you through point A to point B, and you're going to thank me later. And yes, that I, hey doc, thank you so much. Patients that when I see them the first time, they were super scared to come in, and now after the third or fourth appointment, they were like so like, ooh, they're a different person. So that to me, it's a lot. That's
I
my
love the
biggest joy.
tears of joy. Yes,
Yeah,
I can
yeah.
agree with that.
That's a joy.
The happy tears that, oh,
Yeah.
thank you, I'm happy. And then
Yes,
you're like,
yeah,
oh,
yeah.
thank you. After all the work, yes, thank you. I appreciate
It
you
is a
like
tough
it.
profession, don't get me wrong. Sitting in the chair, you know, you open your mouth to a stranger, very close, you have needles and stuff. It's I know it's hard, even if I'm a patient and you're a patient, it's not easy. I mean, we're not like a restaurant, like, oh, I want to go and eat, it's so yummy, but I'm going to the dentist. You can't wait to go to the dentist. Yeah, I can't wait to go to the dentist. Like, nobody. So you have to make it extra special, you know, always. And I think that's super important to keep in mind.
Do you find that people are telling others about you and saying, oh my gosh, you are not going to believe this?
Absolutely.
We're hoping, yeah.
Absolutely. We have a lot of patients that I say, hey, I tell everybody about you guys, and it's not only us, it's our team. It's from the moment you walk through the door, and whoever welcomes you, and my assistant, and everybody. And I see a lot of patients, I hear them say, hey, I always tell my friends about you guys. So that definitely, that tells you you're doing a good job.
And just a couple more things I want to ask you about. I saw your two little ones. They are stinking adorable, and they see mommy and daddy working. They see you in the office. They see you work. What do you want to teach them through? First of all, do you want them to follow in your footsteps?
Whatever makes them happy.
But I would love to. Yes, I would love to.
He wants to leave a big legacy. I said, whatever makes you happy. You want to be an artist, you want to be a singer, you want to be a doctor, whatever you want, that's going to be. And we grew up with hardworking parents, and we learned from, I can speak of that, and I talked to your mom, and it's like the same thing. I mean, I saw my parents not only being professionals, but also being at home and raising us well. So,
were your parents in the dentistry?
my mom, oh gosh, I have like 4 generations of dentists in my family, yes. So yes, but I grew up seeing my parents, and I think like that's what sets the example of, you know, if you're gonna do something, do it with care. My dad is a retired OB-GYN, and for me, seeing how they genuinely care about people. Now my mom is a school teacher and she cares about people still. I feel like that set the example of how we want our kids to grow, and we bring them here all the time.
All the time.
Whomever comes here, they're gonna see them running around, and we are having them like check and touch and talk to patients, and you know, we don't hide things. We're like, yeah, this is what we're doing, this is the before, this is the after. So we are educating them so they notice how beautiful this profession. It's not easy, it's tough, but it's a beautiful one, and it required
a lot of work.
We expose them on a daily basis to the office, to what we do, and I tell my daughter, which is 6, I say, hey, this is your office too, so she kind of feels a sense of ownership as well. She comes here and then she asks about, she knows the names of our team, and she asks about it, and she's always in the mix. And then sometimes I like to come dressed in scrubs and surgical scrubs. So yes, this is a day-to-day by them, and I expect them, if they don't like being the dentist, it's because they really didn't like or wanted to do it for sure, because they've been super exposed to it.
Yeah. And did this also come from your parents? Were your parents involved in that? No?
My dad is a lawyer, my mom is a housewife, and no, I don't.
So where did that come from?
I wanted to be a plastic surgeon, okay? And I love medicine, and I studied so hard to get into medical school, and for some reason I didn't. And then what happened, I was so frustrated because I really studied hard. Then I took a sabbatical year. I said, like, let me recoup and see what I want. And then one day a friend of mine called me and said, hey, there's a dental school. There's a test for you to get in. And I remember, I'm just gonna go and take the test. I didn't study at all. So I was between the top 10 and the test. So
Wow.
Of thousands,
of thousands. So I went into a profession that I know was like healthcare. I was like, well, healthcare. I didn't know what to do. So as I went, it was, growing on me, and that's how I ended up being a dentist. Yeah, by default. Yeah.
And what is also cool about what you all do is that you are already giving back to your community. I mean, you've had this business now for how long?
Yes.
A year and a half.
Yeah, a year and a half.
But you do pro bono work.
Yes.
So tell me how that started. Is that something that was always part of the plan? Or that's really soon?
The biggest joy it's given, and
Yeah.
I know that that's something that if I could do dentistry for free, I would do it.
Yeah.
Trust me, I would do it. It's something giving out, helping. For us, it's really, we care about that a lot.
Gratifying.
And the pro bono cases, we've decided to do it because, there's really some people that, deserve it. You can help them to change their life, and if we can be part of it, that's the best part of our job.
And I do want to talk to you about my coworker, Matt. You met Matt. You are also going to help him pro bono. I mean, and you took a look at his situation. How much work is going to be involved?
A lot of work, but it's going to be an amazing gift for him. That's going to change his life, and it's the work is actually very complex. That's when our specialty comes into play. Being a prosthodontist, so the placement of implants and a full mouth reconstruction. That's what we're the best at, and then that's what we're going to give him.
Yeah, and I know his diabetes robbed him of most of his teeth. So, it's a very personal, very, sometimes embarrassing situation. But how are you able to do this? Because this kind of work that you do costs a lot of money. I mean, we're talking like tens of thousands of dollars. How are you able to just help people and do it for free?
We have an advantage here that we have our own lab technician, and you have an in-house lab. So that is something that we can
We can make it happen.
Yeah, we can make it happen. Having our own lab tech, that we don't have to outsource that at an extra cost. We have it here. We can control it, and that really helps us a lot. Also working around the schedule, we can dedicate a day for him, where we don't stop operations for other patients, and the office keeps running as a business. But definitely, we also have 2 associates that are wonderful, Dr. Shimanov and Dr. Hanson, that they can help us seeing other patients while we're doing this. So the setup we have, it's perfect for this. I mean, perfect.
Have you done a lot so far? 1, 2? How many have you done so far?
Of these cases?
Of pro bono cases.
Well, this will be our second one in this year and a half. and definitely
We try to help him the best way we can.
Yeah,
Fernando is very generous. He doesn't like talking
I
about
do like,
it. But
I do like mini pro bono cases all the time. Anyways, you
Yes.
know, like helping patients
I'll
here
help
and there,
you.
a little
I'll
bit
help
here,
you.
a little bit there, we'll do it.
Yes.
So, but like a pro bono case like this, of this magnitude, this will be our second one. We have a first one going almost like parallel. So I would say like Matt is probably also like the first one too. We're doing both at the same time. Okay. And we're really, really excited.
And what's next for you? I mean, I know I took a tour with you through the business, and you were talking about plans to do this and that. What can patients look forward to?
So basically, we want to provide the perfect environment, not only for general dentistry, but also for the prosthetic side and the surgical side. So we are expanding the office a couple more ups at least, and so that way we can be more available and more suitable for what we do.
You can do the surgeries right here?
Yes.
Yes.
Yes,
We're
definitely.
doing it here. Also, I've been thinking about lately because of the healing. We're incorporating a hyperbaric oxygen chamber, which is great as well for our patients, and do that for post-op surgery and post-op cases. That helps a lot in the healing of the mouth, and expanding and being able to accommodate and provide more dentistry to help our community. It's mainly
Yes,
like
that's something that we
that's
have
our
in the
drive.
horizon. So we're
Yes.
going to start looking for charities, so where we can,
Yes.
spend extra time of our time and do, pro bono cases and help the community.
We have sponsored
Yes.
Tennis for Cancer too. That's a big thing around the community, a cancer event. And yeah, we're always looking ways to give back because we're very lucky. As I always said, we're very grateful with America, what is giving us everything. So the best thing for us to thank America is just giving back.
Which is so exciting. I'm excited for you. Thank you so much for talking with me. I appreciate it.
Thank you.
Thank
We're
you for
very
coming. We're
happy
very
that you're here.
Thank
Yes.
you, thank you.
You heard the Padrons talking about my friend Matt. Well, Matt Harms was the very first podcast I ever did. He's my coworker at the TV station. He got a cut on his foot back in October of 2023. All of a sudden, within a week, his foot started turning black. He went to the ER, had no idea he had diabetes, and within 24 hours had to have his leg amputated above the knee. Diabetes also robbed him of most of his teeth. So the Padrons wanted to surprise Matt with the gift of a brand new smile, $40,000 worth of dental work. You can probably imagine his reaction was priceless.
Like a consultation kind of thing. I'm not sure. Like, I didn't set it up. A friend of mine, Joy, set it all up with the doctors. So, yeah, I'm just kind of going with the flow.
Is it Matthew?
Yeah.
Let me just speak with the doctor.
The way it's gonna go, I will go ahead and have Elisa take some pictures or x-rays of your mouth. Literally pictures of everything we have inside with a special camera. And then she's gonna take it to the back so we can take a CT scan. CT scan is a three-dimensional x-ray where we can check in the software three-dimensionally your teeth.
Wow.
Okay, not only your teeth, special areas that we need to avoid if we do treatment, and also what kind of quality and amount of bone we have. Okay.
Hello again, man.
How's it going?
Good to
Nice
see
to see
you.
ya.
Nice to see you, man. We heard a lot about you.
Yeah, same.
Are you excited to be here?
I am excited. I'm nervous to be here, but yeah, like my diet I have to watch because I can't really eat a lot of
Yes.
stuff, so it's hard to have a healthy diet when you can't really eat a lot of like I can't eat nuts really. And stuff
Absolutely. We want to give you a special gift to you. Okay? So I want you to open it.
Like that. Wait, what is this all about?
Okay? This is a treatment that it's fairly complex. Okay? It's gonna where you're gonna have implants done, the whole 9 yards, and we're gonna give this to you. Okay?
You deserve it.
Yes. Yes. Okay?
Thank you.
You're more than welcome, man. I hope you enjoy it, okay? We're gonna be working together. You're gonna see us a lot. Okay? I hope you don't mind. Okay?
No, y'all are cool in my book. Oh man, I wasn't expecting that this morning. I get free teeth, which is just blessed.
I hope you enjoyed that episode. I'm so excited for Matt. He should have everything finished, the whole operation done by the end of October, pretty much marking 2 years when he found out he had diabetes and had his leg amputated. Matt told me there were several times where he almost died because of medical complications. So he believes that he is still here for a reason. And hopefully this new smile will give him that confidence to share his story more and help others. Thanks for watching. Be sure to subscribe on YouTube, follow me on Apple Podcasts and Spotify, and we'll see you next time.